Well, they are often overlooked and forgotten when it comes to healthcare disparities. Dr. Tiandra Love is a member of the Chattanooga chapter of the Links Incorporated. She joins me now with more on their upcoming event, Care Amore Wellness. Welcome, Dr. Love. Thank you so much for being here.
Thank you for having me.
So let's talk about how this got started.
It got started about the needs in our community. I've been a physician in the community for a long time and looking at access, resources, and education. And I was talking to one of our Link sisters late at night, and it just came to me as a vision. We talked about it, we discussed, and we implemented.
So one of the things too, so you talked about this and it came as this vision and something you thought about it and you implemented. So you've seen the needs of, like, a lot of times when we talk about health care disparities, we overlook our seniors and some of our most vulnerable there. And you talk about what you see those needs are.
Yes, those are access, education, resources, and bridging that gap and bringing to awareness what are the needs for the different age groups. They have been the foundation of our community and of our families, and so they need resources too.
Let's talk about some of those resources when it comes to Care Amore Wellness.
So the resources starts with screenings for breast cancer, breast awareness, CT lung awareness and screening, blood pressure screenings and awareness, diabetes education awareness, kidney awareness and education in regards to that. Because when you think about the healthcare disparities and what affects our seniors and African Americans, those are the critical areas that you have. Also, we have donor awareness, life awareness to that, because we are hesitant when it comes to knowing about donors when things happen, or even when we're alive with donors. The other thing is blood. We always need blood.
Yes.
So having blood assurance there to help us bridge that gap too, so we can have blood and access for patients who need it in the hospital.
That's so important. And we have some pictures that we'll be putting up throughout this to show some of the past, last year when you all were there at Care Amore and the different things. And you also bring the community together. You bring different organizations in to help and tell, these seniors about their resources that are available in the community.
Yes, because we're all doing a lot of the same things. Mm-hmm. So why not partner together to serve the community? That's what we do. We're partnering to serve, and it's a mode of fellowship, and then making a realization that we need to make sure we take care of ourselves too as well.
And that's so important in looking at that and talking about, taking care of ourselves, because a lot of times when we see these, you think about your parents or your grandparents, and, if they were in this situation, you would want them to have this help and this care. And so again, you go there and you've met these people, Dr. Love, and you say, hey, they need these services. This help is not available. And so that's where you're taking action to bring this to them. And that's the other thing. Sometimes when we talk about access, you're bringing these resources to them.
Yes, I do. And then it's faith-based too. So we have one that's in the spring and we have one that's in December. And bringing that sense of community, that sense of culture, that camaraderie, and then too, meeting patients or people where they are. They may not know about it, they may not feel comfortable getting out or even saying something to their own providers. So how can we bridge that gap? How can we provide the resources and work together?
And that's so important. And again, this is, part of the Chattanooga chapter of the Links Incorporated. And, I'll say in full disclosure, I'm a part of that organization. So tell people who aren't familiar about the Links and the mission and what the Links do in this community.
Links Incorporated 17,000 African American women in the organization. We have over 400 chapters, and we put in facets, and we volunteer services in the areas of services to youth, national trends and services, international trends and services, and health and human services. And it's meeting those disparities. It's training up our youth in different departments and even in the arts. So they've been around since 1946 by two African American women who started in Philadelphia in their living room, and seeing the need then and the needs that are still present ever today now.
And that's why again, this event is so important. So remind people of when this is taking place.
This event is December the 16th. It's from 9 to 3. It's the World's Church of the Living God. I'm a member of there, have been since birth. And it's on 2110 Glass Street. And so come out, fellowship, get the screenings and the services that you need. And it's the end of December, so if you can come out and get the end of the year mammogram or the CT lung screening, and just be aware and check on your health and check on yourself.
That is so important. We cannot say that enough when it comes to checking on our health, taking care of ourselves, because our health is so important. Dr. Tiandra Love, thank you so much. Always a pleasure.
Thank you, Latrice, for having us.